Why does my Medicare EOB show unexpected out-of-pocket costs? Have you ever looked at your Medicare explanation of benefits and wondered why the amount you owe seems higher than expected? You're not alone. Sometimes, your EOB shows extra charges that catch you off guard. Let's break down why this happens and how you can understand these costs better. First, an out-of-pocket cost is any amount you pay beyond what Medicare covers. This includes deductibles, which are the initial amounts you pay before coverage kicks in. For example, Medicare Part A has a deductible of $450 for each benefit period. After that, you might pay co-payments or co-insurance. If you visit the hospital, you could owe a co-payment of around $300 per stay, depending on the length of your stay. Next, for prescription drugs under Medicare Part D, costs depend on which stage of coverage you're in. During the deductible stage, you pay the full price of your medications until you meet your deductible, which can be up to $450. In the initial coverage stage, you pay a co-payment or co-insurance, usually around 20% of the drug cost. If you reach the coverage gap, often called the donut hole, you might pay more out of pocket until you reach catastrophic coverage. Once you hit that, your costs drop significantly, often to a small co-insurance or co-payment. Your EOB will show which stage you are in and what you owe at each point. Sometimes, your provider bills more than what Medicare approves. If your doctor or hospital charges more than the Medicare-approved amount, you are responsible for the difference if they do not accept assignment. For example, if your provider bills $1,000 but Medicare approves only $800, you pay the remaining $200. This can happen if the provider is out of network or does not accept Medicare's approved amount. Billing delays can also cause surprises. If your provider submits the claim after you receive care, your EOB might show costs that weren't clear at first. Sometimes, adjustments are made later, which can change what you owe. Income can influence your out-of-pocket costs too. If you pay higher premiums for Part B because of income-related adjustments, your monthly costs will be higher. These adjustments are based on your income from 2 years ago and can increase your premium amount. Reviewing your EOB carefully helps you see exactly what services cost and what you owe. If you notice unexpected charges, contact your Medicare plan or provider to clarify. Sometimes, billing errors happen, and they can be corrected. Remember, your EOB is a statement explaining costs, not a bill. Understanding these details helps you manage your healthcare budget and avoid surprises.